Hello, good afternoon, good evening to everyone. Very happy to talk to you all about asthma today, the environmental and social exacerbations associated with asthma and respiratory conditions. My name is Elizabeth Churcheo. I'm the Director of Climate Health at Cooper Medical School of Rowan University and Associate Professor of Medicine there, where I clinically act as a hospitalist. And so I see a lot of asthma patients coming in. My disclaimer is that I see adult patients and we're going to be talking about some pediatric cases, but there's a lot of overlap. So let's get started. We're going to go through the social determinants of health and how they predispose especially vulnerable communities to developing asthma and having poor health-related outcomes. We'll go into a little bit more detail about specific air pollutants like particulate matter and ozone and how they can contribute to lung disease. And then we'll list some of the asthma health outcomes that are worsened by climate-related air pollutants and allergens, and discuss some anticipatory guidance and preventative care that we can recommend for our patients. So we're going to start with a case. Jordan is an 8-year-old child presenting for a well visit. Although he's feeling well right now, his mother reports that Jordan has had 3 episodes of feeling out of breath during his soccer practice. He's had experiences like this before, usually during the nighttime and after physical activity, that are accompanied by wheezing and coughing. During your detailed history of environmental exposure risk factors, you find that Jordan lives with pets, has a father who smokes in the home, and has had mold exposure, which was recently removed from the basement. So there's a lot of epidemiologic risk factors that we're seeing in Jordan's case that really epitomize a lot of our patients' experience. And sometimes if you don't do that additional digging, you don't find out about risk factors like mold in the basement or like someone who smokes in the home. It really requires a high level of sensitivity to what some of these environmental concerns are. We know, though, that there are certain communities and populations that are going to be disproportionately harmed by climate and environmental risk factors. Certainly, extremes of age, children, older adults, people who have underlying illnesses and comorbidities, and communities of color, immigrant communities, low-income communities. These are all groups that may be disproportionately harmed. Often we'll talk about environmental justice communities or environmental racism, and this refers to communities that are maybe placed more in harm's way. So we may be talking about communities that are near high traffic areas and highways, communities that abut major industries and polluting industries, maybe near fracking sites or incinerators. These are all areas that have actually been termed sacrifice zones. So there's a reason that they're called sacrifice zones. We know that these people are experiencing a disproportionate level of exposures. And it may not even just be air quality. They may also be in urban heat islands. They may be experiencing problems with water quality, or also be prone to vector distribution and ecology issues. They may, if they are in the Northeast, be prone to flooding and have combined sewer systems with stormwater drains, and so can be at risk for water quality from that aspect as well. So there are many climate sensitive health risks that could potentially be overlapping. Right now, we're going to be really focused on the respiratory illness part of it, but people who are exposed to poor air quality can have cardiovascular concerns. They can even have problems learning. There's other mental health aspects. So there's a lot of really overlapping concerns. We're really just going to focus right now more on the pulmonary concerns. So one place to start is with particulate matter. We will usually talk about particulate matter based on the size. Particulate matter that's 2.5 microns is just an infinitesimal amount, that little tiny purple dot compared to the width of a human hair. We will also talk about PM10. PM10 is often the size of dust or pollen, and that might get lodged in your upper airways. It might cause some cough or irritation. PM 2.5 is so small that when you breathe it in and it goes through your airways, it goes through your bronchioles, through to your distal alveoli. It's so small that it can traverse those alveoli and get into your systemic circulation. And the problem with that is that it then triggers inflammation and oxidative stress. There's even mutagenicity that's associated with it. So that's why when we talk about PM 2.5, there are so many downstream impacts from it. There's also other things that we breathe in as well. Ozone, trace metals, all of these can have deleterious impacts. And we know that even within PM 2.5, all PM 2.5 is not necessarily the same. We know that when there are wildfires and when buildings are involved as well, that construction material gets aerosolized. That's particularly deleterious. There's ultrafine particulate matter, which is even smaller than 2.5 microns, and that's particularly associated with traffic and fossil fuel combustion. And that is very, very damaging to human health. So we really do get very concerned that when we talk about PM 2.5 and ozone, and these are metrics that are commonly reported from things like airnow.gov and other air quality sources, so we can direct our patients there. I should also make an allusion to ozone as well, because there's stratospheric ozone and tropospheric ozone. And the stratospheric ozone is what protects us from UV radiation. The tropospheric ozone is what's close at ground level to us. And the problem when it comes to heat waves, which you can see can actually trigger respiratory diseases, is that as it gets hotter, there's more and more ground level ozone, or sometimes we'll call it smog. And that's because oxides of nitrogen and volatile organic compounds, which are produced from traffic and fossil fuel combustion, will get catalyzed into ozone in the presence of sunlight and heat, so that you'll have this perfect storm when you're in the middle of a heat wave where it gets hotter and hotter and the air quality deteriorates and gets worse and worse. So patients who are vulnerable to respiratory conditions are going to be at high risk then. We also have to consider, as in this case, the risks of flooding, and many affordable housing units will be built on areas that are prone to flooding. There's an intentionality to this, and so we really need to ask about flood risk, and also cockroaches, because cockroach feces are very allergenic, and so you can have these compounding risks. There's an association of asthma exacerbations and hospitalizations following thunderstorms even. And there's also associations with prolonged allergy seasons. And that's because as it gets hotter, the allergenic plants, things like ragweed, will grow into areas where they were not present before. The other problem is that at higher CO2 concentrations, the allergenic component of the pollen, which is the AMB1 protein, will actually grow more robustly. And so there'll be more AMB1 protein produced at higher and higher CO2 concentrations. When they've done studies along the sides of major highways, and they check the pollen producing plants along the side of those highways, they actually produce much more pollen than even plants that are a little bit away from the highway and away from those fossil fuel combusting vehicles. So these are all important considerations. There's also changes in fungi and also other pathogenic microorganisms that we should consider as we're counseling our patients. So as we're working with our individual patients, we need to give them information that is going to be helpful. We also need to uncover potential risk factors, just as in this case, as we uncovered the risks of mold and a father who is smoking in the house. These are potential conditions that could be avoided. We also want to, whenever possible, counsel our patients to download things like the airnow.gov app or other air quality apps. We can, if they're able to afford it, counsel patients to invest in air filters within the home, particularly if there's a HEPA filter, to invest in high efficiency vacuums, to switch from gas burning stoves to electric stoves, because we know that gas burning stoves are associated with asthma, incident asthma and exacerbations. So these are all some recommendations we can make. We can also tell people to take off their shoes before they come into the house and leave it outside the house. So there are some common sense recommendations, and then there's other avoidance that we can recommend, like not smoking in the house. We can counsel our patients directly if there's high levels of pollen, that this should be a time when they're particularly careful and maybe to avoid outdoor activity then. And we can also talk about the association of climate change and air pollution being related to burning fossil fuels. We know from research, particularly in pediatrics, that regardless of the political affiliation, parents are very open to conversations about climate change and their children's health. So we can incorporate this into our messaging in primary prevention. We can talk to them about checking air quality and avoiding busy roadways whenever possible. So I hope that this information has been helpful to you all and certainly to your patients.